All right, well, another issue that's caused a lot of consternation down south in Victoria, the Andrews government announced that they're keeping the controversial North Richmond injecting room open for another 3 years, but they're also planning to build a brand new one in the heart of the city of Melbourne.
There is a need for us to do more to save lives and change lives, not just in North Richmond, but according to our expert panel, in the city of Melbourne as well. And that's why we, as a government, will bring a bill to the Parliament to establish a second medically supervised injecting room in the city of Melbourne on Victoria Street, just opposite the EPA offices there.
You heard that there, the Premier is locking in that North Richmond facility. It was open in 2018. When it was first opened, of course, he called it a trial. Now, he had to do that, given in February 2017, Daniel Andrews said, and I quote, "I have been very, very clear prior to the election and since, we have no plans," he said, "to introduce a facility like that." Yet he brought one in, despite strong opposition from locals and traders. And now, he says, another facility for heroin and ice users is needed. For context, the new injecting room is set to be located on Victoria Street, about 100 metres on from Victoria Markets, the Queen Victoria Markets, one of Melbourne's busiest shopping hubs and close to 2 universities. And while Melbourne's Lord Mayor, where this new facility will be located in her precinct, so she hasn't been consulted, another mayor, City of Yarra's Misha Coleman, backs up Andrews' plan and is calling for up to 6 more such injecting rooms across Victoria.
Right at the moment, injecting drugs or drugs that are injected are illegal. And the reason we need another 5 or 6 across Melbourne is because we've got the busiest centre, one of the busiest centres in the world.
I spoke with Georgie Crozier, the Victorian Shadow Minister for Health, earlier. Georgie Crozier, thanks very much for your time tonight. What's the opposition's reaction? What's your reaction to the Premier's announcement that there'll be not 1 but 2 heroin injecting rooms in Melbourne, and this one planned within 100 metres of the Queen Victoria Market precinct? For people outside of Melbourne, that's right in the CBD, basically the corner of Elizabeth Street and Victoria Street. It couldn't be any closer to Melbourne's tourism hub, could it?
Well, Peter, you're right. It's very close to Queen Victoria Market, which is a very well-known tourist precinct. And, of course, this is within a residential area and a business area. Traders in the Victoria Market have expressed their concern. The Premier came out on Friday afternoon and made this announcement. You've got to wonder why. It was the Friday before the long weekend and before Saturday's protest, so he can't be too proud of it. And it's evident because of the outcry from not only those traders and those residents that live within that second injecting room precinct, but also the Lord Mayor, who haven't been consulted. No one has been consulted on this decision. And it goes to show just the arrogance and secrecy about how Daniel Andrews operates.
But isn't this how the first injecting room came to be in North Richmond? There was no consultation. Correct me if I'm wrong, it was a byproduct of the Northcote by-election. It was not mentioned before the election. And I've got to ask you, the experience of traders there, I've spoken to a number, I've been there and wandered the streets in the evening. The local area in terms of restaurant hubbub has been decimated, notwithstanding the fact that it's right next to a primary school. I'll get to that in a moment. But what's the reaction and what's the experience of the first injecting room in North Richmond?
Well, I think if you go and speak to, as you have, speak to the traders, the business owners and the residents, they will tell you just what has gone on in terms of the increase in crime, the feeling that they don't feel safe, the increase in drug dealing and drug use. And they're the ones that it's had an enormous impact on that local area. And well before COVID, the Victoria Street restaurants and businesses have been hugely impacted since the opening of the injecting room. So that's not me saying it, that's the residents and the traders, and even the Police Association themselves, when they conducted their own survey amongst their members, 80% said yes, crime had increased, crime against the person, crime against property, and then you've got all the very, very severe antisocial behaviour that has been going on since the opening of the injecting room. It has been like a honeypot effect, and the increase in crime in that area has really had a massive impact on those families. I've been told from residents that that they don't feel safe, but even on Friday, when this announcement was made to extend the trial for another 3 years in North Richmond, that they're pulling their kids out of the local primary school and they're selling up. They've had enough. They are leaving the area because they feel that they just haven't been listened to and no one's taken any notice of the true impacts to their local area.
So talk to me about the location of the Richmond site, and notwithstanding the fact that we're talking about a second site, but the Richmond site's right next to a primary school. We know if you're using illegal drugs, someone's got to sell them to you. You can't walk into a pharmacy and buy them, of course. So it brings the dealers into the local vicinity. Well, if the drugs are illegal to deal and they're illegal to buy, but they're illegal to use other than inside these injecting rooms, are police turning a blind eye to the dealing that goes on? And what's been the reaction of the Police Association on this new move? Because I don't think, if I remember rightly, they were that happy with the initial North Richmond centre either.
Well, you're right. It is metres away from a primary school, which is just ludicrous. You shouldn't be having an injecting facility in such close proximity to a primary school, for heaven's sake. And the Police Association on Friday have come out very strongly and said that they don't agree with the decision. They feel that local communities should have a say in the decision-making process of a second injecting facility, and that simply wasn't done. There was no consultation whatsoever. So they have come out very strongly because they know that what the experience in North Richmond has, with the increase in crime and the lack of personal safety and other issues that have been associated with the opening of the injecting room, that will happen in the Queen Vic Market site. And they say there's no greater use of drugs at that site than there is across Melbourne. So I think they have a very good point to say why was no consultation undertaken with anyone, not with the residents, not with the traders, not with the business owners, not with the Vic Market, the tourist precinct or the association or the Lord Mayor in relation to this decision. And I think it's incredibly an incredible example of just how the Andrews government is operating at present, having no regard for anyone and making these decisions without consultation.
What's been the level of transparency, you, the opposition? Have you had briefings from the government? Have you been privy to some of the expert analysis in the report the Premier claims? It says there's a justifiable need for a second injecting room in Melbourne. I mean, Sydney has had one injecting room for well over 2 decades, and Melbourne, within a matter of years, will go from 1 to 2.
Well, yes, but there are differences. Don't forget there are differences between the Sydney injecting facility and Melbourne. I mean, the Sydney injecting facility has health professionals that are working in that injecting facility. It's not situated in a residential area next to a primary school. We've had drug dealers who have been caught operating out of North Richmond. Don't forget, there are so many issues. And in terms of your question about the briefings, we've put in 25 FOIs to try and get some understanding of what's actually happening in North Richmond, of which we have never got an FOI in its entirety. It's always had documents missing. So that goes to the issue about transparency and the information we're seeking, and I would like a full briefing on this report from the panel. I'm hoping to get that. But it goes to the extent of, well, we can't get the information out of FOIs, and it goes to the heart of how this government operates in terms of their secrecy. And this is
just on that point, though, the Premier says that all these lives have been saved, thousands of lives have been saved. Do you know if that's accurate? And what are the diversionary programs in place? I mean, if people present, and I have to say you can use ice, which is a violent drug at this centre in North Richmond, and I presume it's planned for Queen Vic Market as well, ice and heroin. What sort of programs are they putting people on methadone programs? Is there intervention at this site as well?
Well, we don't know. We don't know, and I wish we did know. I wish we could get that data and understand exactly how many people have been successful, for all the referrals that have gone from North Richmond into other services, how many have actually been rehabilitated? How many of those 4,000 people have actually been successful? Have any died? We don't know of the people that the government claims their lives have been saved. Are they individual cases, or are they the same people having the same problems and having their overdoses reversed? Is it, for instance, 50 people having their overdose reversed 60 times, or is it 3,000 odd individual cases? We don't know the details of that, and I think that's what I need to understand from this report in relation to the outcomes. I mean, we want people to be off these terrible drugs, and I think the real measure for the government is the success of those people getting off those drugs. And if you drill down those figures, you don't know. It's not answered. Those questions aren't answered, Peta.
Georgie Crozier, thanks very much for your time.
Pleasure, Peta. Thank you.